Case number 8. A 17-year-old male with sickle cell disease presents to the clinic with sudden onset flank pain and hematuria. Which diagnosis you should consider in this case? A. Urinary tract infection. B. Kidney stones. C. Renal infarction. C. Pyelonephritis. Correct answer C. In sickle cell disease, renal infarction is a possible complication due to the occlusion of renal blood vessels by sickle cells. This can lead to ischemia and infarction of kidney tissue, presenting with symptoms such as flank pain and hematuria. The unique nature of the renal medulla, which has a relatively low oxygen environment, makes it particularly susceptible to sickling and vaso-occlusion. Renal infarction in sickle cell disease can be part of a vaso-occlusive crisis affecting multiple organs.